The Civil War.
Medicine.
Brought to you by
This is our video of the Civil War. We'll be showing you the battle tactics of medicine. The nurse is now going to show you the latest medicine techniques and the type of medicine used during the Civil War. Here is some of the medicine we used during the Civil War. The medicine we have here is chloroform. We also have morphine. Morphine is a pain reliever. Generally, Civil War doctors underwent 2 years of medical school. Most Civil War surgeons had never treated a gunshot wound, and many had never performed surgery. Yet, for the most part, the Civil War doctors, as underqualified and undersupplied as they were, did the best that they could. The deadliest thing that faced the Civil War soldiers was disease. For every soldier who died in battle, 2 died of disease. Civil War soldier also faced outbreaks of measles, smallpox, malaria, pneumonia, or campit. In brief, the high incidence of disease was caused by neglect of camp hygiene, insect exposure, lack of clothing and shoes, poor food and troops from rural areas were crowded together for the first time with large numbers of other individuals and got diseases they had never been immune to before. Both armies faced problems with mosquitoes and lice, lack of shoes and proper clothing.
The diet was absolutely awful.
To halt disease, doctors used many cures. Doctors prescribed green vegetables. Whiskey and other forms of alcohol also were used to treat wounds, and whiskey did relieve some pain. Most medicines were manufactured in the North. Southerners had to run the Union blockade in order to gain access to them. However, many of the Southern medical supplies came from captured Union stores.
Bloody fingers often were used as probes, a blunt-ended surgical instruments used for exploring a wound or part of the body. Bloody knives were used as a surgeon knives. Everything about Civil War surgery was filled with bacteria. Surgical fevers and gangrene were constant threats. The surgeon and their assistants, stripped to the waist with blood, stood around, armed with long, bloody knives and saws, cut and sawed away with frightful rapidity, throwing the mangled limbs on a pile nearby as soon as removed.
75% of amputees did survive. During the Civil War, the experience and training of the doctors wasn't well regulated. The Union Army only had 98 doctors registered, and the Confederacy had only 24. And believe it or not, 3/4 of surgeons' time was spent amputating limbs. Most wounds suffered by Civil War soldiers were on arms and legs.
Oh, the pain!
Amputations was the wounded soldier's best chance of survival. 3/4 of amputees survived. The sooner the amputation was performed, the better the chance of survival. If the amputation was delayed more than 48 hours, blood poisoning and bone infection would set in, and the death rate would double. This was a very painful way to die. It was actually best to amputate within 24 hours. Many doctors used anesthesia in the forms of chloroform, and even when they operated, especially near the end of the war. A patient's chance of survival depended on how far the wound was from the trunk of the body. Doctors often took over houses, churches, schools, even barns for hospitals. A capable surgeon could amputate a limb in less than 10 minutes. Surgeons worked all night with piles of limbs reaching 4 to 5 feet high. Lack of water and time meant they didn't wash off their hands or tools. When soldiers were wounded in battle, the infirmary corps carried the wounded to a forward aid station. There, an assistant surgeon would give the soldier alcohol and painkillers and would try to stop the bleeding by packing the wound with lint and bandaging it. If the bleeding would not stop, a gauze would be applied. This would stop the flow of blood to the limb, which meant the limb would have to be amputated.
At the field hospitals, the operating table was often a barn door supported by 2 barrels or similar objects. Doctors wore no mask or cap to tuck their hair under. There were no gowns, just an apron. The operating table was probably not cleaned after each patient, so it would be covered with blood and filth.
The surgeons used large cotton press as their butchering room.
I was carried into the building and looked about. I could not help comparing the surgeons to friends. It was dark and the building lighted partly with candles. All around on the ground lay the wounded men. Some of them were shrieking, some cursing and swearing, crayfish, and some praying. I was moved by ambulance to a hospital further down from the fighting. This was a bumpy ride, and I was already in horrible pain. From this point, I was often moved by rail. In the winter, the rail car was freezing cold. On the long, horrible trip, there was no water and nothing to kill the pain. Infection was the #1 cause of death after surgery.
Eat some grass. You want a picture? Eat the phone. Whoa, whoa.
If you run,
But I got scared. Sometimes in the act, workers would get tired and drop them down a hill.
here, just get on my back.
Some of them were shrieking.
We're done.
We can drag her up, I mean.
Yeah, do that.